Good evening, everyone. I'd like to welcome you all to this CERSI webinar organized by the European Trainee Forum. I'd like to start by introducing myself. So my name is Maha Al-Katab. I'm one of the radiology, interventional radiology residents in University Hospital Galway in the west of the Republic of Ireland. The webinar today will focus on renal tumours and the evolving IR role in its diagnosis and management.
You can see there's a small bowl for disinfection of the skin. There is a sterile isolation foil for the patient and for the ultrasound probe. There are syringes for lidocaine, scalpel for a small skin incision, and we usually use a longer 22 gauge spinal needle for renal biopsies to do the local anesthesia. There is some gauze which we usually use to control the ultrasound in a sterile manner and keep the area clean, for example, after the skin incision. And this is our biopsy gun. This one is an automatic gun, but we also use semi-automatic biopsy guns with a trocar system for kidney biopsies.
And after planning, we activate we activate this laser, which tells us where the entry point in the skin is, but you can use other systems as well to know where to start with the needle. And then we put in the needles by the planning. And then when you start the treatment, you can see this is a cryoablation because you can also see the eyes here on the several needles created along the shafts here. And this is a CT image of, you can see several needles around the ice ball that is started to be created.
You are at the right position and you need to stop the bleeding. There are many embolic agents like coils, like microspheres, glue, onyx, vesicle plugs, and so on. With the coils, you are on the safe side, especially for post-procedural bleeding. For some spontaneous bleeding, coils are not maybe the best choice because in spontaneous bleeding, it implies that patient had some kind of coagulopathy, so coils are then maybe not the first option. But here, in this kind of especially emergency situation, coils are just fine. It's easy to work with them, to deploy them, and they will do good job.